So, Anith, thank you so much for making time to share your insights into the future of leadership. But before we walk into the future, can you please tell us a little bit about your background? Where did you grow up?
Thank you very much, Nick. Thanks for the invite and for the interview and for the opportunity. So I was actually born in Nigeria. My parents were teachers who had immigrated there from Kerala in India. I was born there, and my brother and sister as well. But we came to South Africa when I was 5, so I'm South African. And we initially were in Hoek, which is a town just near East London. And then I grew up in King Williamstown, which is 60 kilometers from East London in the Eastern Cape.
And can
In
you,
terms, yeah, sorry,
yeah,
go
can
ahead.
you can you tell us what was your dream career when you grew
Yeah.
up?
Yeah, so when I was growing up, I didn't really have a dream career as such, but I was always interested in business. And then so during my teen years, it was more like I wanted to do business science. Then people said, "Oh, but you're so good at mathematics. Why don't you become an actuary?" So I was actually fixed on doing a Bachelor of Business Science at UCT and then going into actuarial science. But my mom, being a typical Indian mother, said, "No, you need to do medicine." And then, so it was a tussle, especially during matric years. And eventually, I got a admission for actuarial science at UCT and medicine at Wits University. But I got a scholarship at Wits, and with my parents being teachers, and I had 2 siblings who were younger than me, it was more of a financial decision that said, "Okay, go and do medicine." I don't regret it in the end, but yeah, so that was the story of how I started in medicine.
And can you tell us who inspired you in your early stages and in your early career?
Yeah, sure. In early career, after med school, it was always the senior doctors and mentors that way because they'd been there, done that, and they'd experienced life in the public sector, had been there for many years, and so. But even from the beginning, in my first year of internship, I was already like railing against the broken system. And I came back to the Eastern Cape to do internship, and I formed a doctors committee, which didn't exist before, headed it, and made a few changes that were positive for doctors' working conditions during that time. I also joined the South African Medical Association and was a counselor at the time. Um, uh, but eventually, that was from 2005 to 2007. But eventually, like after 2.5 to 3 years of railing against the system, I said, "Okay, I need a break." And then so I went into private practice and joined as a GP at the East London Medicross. And then there again, then the head doctor at the time, Dr. John Fulmer, he was very business oriented, had a lot of businesses that he had developed over the years. And then he sort of took me under his wing and said, "Come, let's also talk about the business side of medicine apart from the practical and the clinical work." So yeah, I had to credit him for that, but not just him. There was also Dr. Nick Fenter and a few others who were in that practice and who helped me at the time.
Now, today you're a leading authority and a leading innovator in one sector of healthcare, which is critically important for the country and affecting 10 million women in South Africa, I believe. Now, looking back over your career, are there any turning points that where things could have gone different?
Yeah, there were a few. I mean, we were just talking about the brain drain, and so when I first came out of med school, I thought of immigrating straight away and going to Canada. So during my community service year, I had applied to go to Canada as a GP, and I was literally this close. I was just waiting for my visa to come in, and then I met my to be wife. And so that was a critical turning point, which then, because she was born and bred in East London, but I hadn't met her before this, and she had just come that year in the February and joined the Department of Pediatrics where I was. And then like we met and hit it off immediately. And then so I was like, okay, so I just sent them one email. I said, "Guys, plans are off, not coming. And then I was supposed to go with a friend of mine who also studied at med school, and he's in Canada now. And, he then contacted me like a couple of months later, and he said, the guys are still waiting for Dr. Chacko, who's going to be coming just now. And I was like, it's not happening anymore at all. So that was one critical point. And then the second critical point also that involves my wife, because it was during that transition that I went to work as a GP in private practice. And then at that point, I had sort of like reached a burnout phase because of the extended academics and, from matric, well, schooling career, med school, etc., and then working in public and then working in private, and the pace there as well and the demands there. So I was burnt out. And I was like, okay, I can just do this GP work for the rest of my life. And she was like, no, 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 Cam, you need to specialize. And then she was like, I'm going to do radiology. Why don't you just? And then I was like, still fighting it. And then eventually I got interested in her, in what she was doing. I then registered for the exam. And then she got a post soon after we got married to specialize. And then she spoke to the professor there and said, oh, look, my husband's also interested, And not that she organized, but she opened the door. And so if she, again, so that's the second one that I can credit her for, where I wouldn't have done radiology otherwise. Yeah.
Thank you. Now, you're tackling one of the biggest healthcare issues and problems in the country on a national level. What is driving you? What is motivating you every single day?
Yeah, so in terms of driving me every day, so in our current work, we do mobile mammography. That's the only work we do. We don't focus on anything else. We've removed all the other distractions. And the reason for that, as you said, there's 10 million women in South Africa over the age of 40 who need annual mammograms. Out of that, 2 million have medical aid and 8 million don't. Out of the entire 10 million, only 500,000 get an annual mammogram. And out of that 500,000, only 80,000 are those without medical aid. So that's the public system. So you can see that's less than 1% of the total coming from the public system. So, and then when you look at even those on medical aid, there's 1.5 million who are not getting it simply because of lack of access, etc. So my purpose, or what drives me every day, is to improve that access, because everybody knows early detection saves lives, but in practical terms, and especially when it comes to women of that age group, they always put themselves like fifth on the list. It's kids first, family/husband, work, community, and then themselves. So. So then if we can improve the convenience at least and the access, then there's less barriers for them to fit it in amongst everything else.
Now, can you tell us what is it you've achieved in your field that you're most proud of?
Well, there's two things. So I completed my PhD at the end of December last year through the University of Bristol. So that one was based on MRIs in pediatrics, so children with cerebral palsy, and how we can quantify it. And then also we develop new methods of displaying it, because again, that also is a big crisis on its own, where in South Africa, because of, again, lack of access, or, a lot of children, especially in the rural areas, are born with brain damage. And then there's this whole medical legal system that's costing the government a lot of money over the years. But one of the key areas where we have helped now is where we provide a system where we simplify the entire MRI or CT scan, so that it can be understood by lay people. So not just the medical professionals, but also the judge or magistrate, the lawyers, and especially the parents, so that they can understand the extent of the injury to the brain. So that's one. And then number two, I would have to say is founding Radhiant in 2023, because that helped me eventually to tie up my initial business interest that I talked about, plus medicine, and have a purpose that was very much, has shown impact already in just the 3 years that we've been in existence.
Now, as a social economic entrepreneur and innovation leader, if your vision comes true and the 10 million or close to 10 million women in South Africa are getting the services you are rendering, what would be the impact on the country? What would you say would be the socio-economic impact on South Africa?
Well, look, I mean, just in terms of okay, let's start with the individuals. Like, I mean, every woman where we detect early cancer is a potential life saved, because you pick it up early enough, and surgery and treatment is almost curative in the vast majority of cases, 99%. So that alone is just longevity and improving life expectancy in that group. And of course, there's the associated individual priorities and so on that we are making impact on. And then when you talk about the larger context, I mean, to date, we have screened 19,000 women. And out of those 19,000 women, we've detected early cancer in 370 of them. And then when you do the calculations and the research, and I've got an article that I'll be publishing in the South African Medical Journal soon, where I've calculated the downstream costs that we have saved the healthcare system. And from those 370, we have saved about approximately 75 million rand. Now, when you extrapolate that, and you realize that in South Africa, on an annual basis, there's almost 11,000 breast cancers every year, diagnosed every year, sorry. That then shows you the scale of the impact. We were talking about billions of rands potentially saved just to the system, plus the whole economic impact of those women then being able to continue working, their families, the impact on their families and their communities that we can't easily quantify, but is far more valuable than just the rands and cents.
Now, if you were to design a curriculum for future leaders, what are some of the key skills you would want to factor in?
Well, when I think about it, I think about my training. And in med school, we had one lecture for 1 hour on business in medicine. And basically and it wasn't even about how to run a practice or anything. It was mainly your personal finances. So fine, good. It was great, but 1 hour out of 6 years. And then when I went into radiology specialization during our training, there was absolutely zero on how to run a radiology practice and the entire stuff there. So those are two big gaps that I can think of just in medicine. But when we talk about leadership overall, the main things that I learned over these, especially these last 3 years and especially this year, is you need to develop your people. And with people, you need to develop yourself first, because you have to be good enough to lead your team. And then you can then start, mentoring them. And it's all a process. I mean, I'm far from like an expert, and I'm still learning every day. But you have to. So one of the key things that I think that any leader needs is, and I think a lot of the A players and those who are in the elite or successful companies, etc., have it, is an intense curiosity. So you need to be continuously learning, continuously innovating, and continuously, looking for new information and that's where the innovation comes from. When you bring in diverse viewpoints and you put it into a melting pot, and then something new, even if it's just an iteration, comes out of that. So.
And as a mentor to many future leaders, can you maybe share a success story or two where you mentored an upcoming leader and that person took your advice to heart?
Well, yes. I mean, in my company alone, like my entire management team is homegrown. And when I say homegrown, they came into the company when we first started, and they've been with me through 3 years. And none of them came in with very much leadership experience, except at a very junior manager role as such. So I've got a head of operations and logistics who was just a junior manager in logistics at the time. I've got a chief mammographer who was nowhere in leadership, but she was just a clinical mammographer and doing mammograms every day. And now she leads a team of 70 mammographers. And those are the two standouts. But over the time, and and my admin manager. I mean, she used to be a PA before, but now she's got a team of her own, and she interacts with the entire company, and she's in charge of the admin for the entire company. So, yeah, those are the three standouts. But those are the three oldest employees. I mean, who've been with me for the longest. but along the way, like it's not that I've created a curriculum of my own, but we have a definitive onboarding process and a definitive way to do things, and we call it the Radhiant way. And then I mentored them along in that.
The Radhiant way. I like that. Now,
Yeah,
Anith, where can our listeners follow you and how can they connect with you?
Yeah, so currently the best way is probably connecting with me on LinkedIn. You can just search for Dr. Anith Chacko. And then the same, Anith Chacko is my handle on Instagram and in Facebook. So that's easy enough. And then if you want to follow the work of our company, the website is rdisa.co.za. So it's rdisa.co.za. And then we also have a non-profit arm. And I'll just quickly tell you about that if you don't mind. Because as we said, so accessibility is a problem, but affordability is also a big factor or barrier in terms of getting access to this. A typical mammogram in South Africa in private for cash, it costs you anything from 2,000 Rand upwards. Our cash price is 1,200 for a 3D mammogram. So, but even that is too expensive for a big percentage of our population. So what we've then started doing in September 2024, we established a foundation through which we obtain sponsorships and donations to provide free mammograms to those who absolutely cannot afford anything. So that you can follow us there for that. And, we invite individuals or companies to donate through that page there at radhiant.foundation. And Radhiant is spelled with an H in the middle.
Right. And last but not least, Anith, what's your message to the millions of learners out there who are about to finish school, start a career? What are maybe one or two success factors that they should keep in mind?
Yeah. So the first thing I'd say is don't leave, stay here, because we need you, and also you can make an impact here. And there are growing opportunities, especially coming up. And if you just look at the last G20 and throughout this year, our business index, confidence index, and consumer confidence index have been going up. The Rand exchange rate has been improving. So I think we're into that phase where we're now, on the upward. So we need you here, stay here, and we'll create some opportunities for you, for sure.
Anith, thank you so much for making time to share your insights into the future of leadership and tackling one of the biggest issues in the country.
Thank you so much for having me, Nick. I appreciate the opportunity.